Good evening and welcome to Mondays with the Midwife. Tonight we're going to be discussing the topic of evidence-based practice. Whoa, wait a minute. Before you change the channel, I promise it's not going to be terrible. What do you think of when you think of evidence-based practice? Are you sitting there with your eyes glazed over because you're like, this doesn't sound like a topic I want to talk about? I get it. Through my journey of becoming a midwife, I kind of felt the same way. Where do I go to find the reliable data? And how can I know that it actually is reliable and that it's trustworthy? As a new upcoming parent or someone planning to become pregnant, I understand that you probably have a lot of questions. Let me just start by saying, I'm sure everybody you tell that you're pregnant to is going to offer you some sort of advice. It's really difficult to maneuver through the advice that you get and to know, is this actually something I want to do? Is this right for me? What is evidence-based practice? Well, let's think about evidence-based practice as a stool that has 3 legs. These 3 legs represent 3 different things that are incredibly important to the stability of that stool. If you take away one, you're not going to have a stable platform to sit on. I think of evidence-based practice the same way. One of the things that are important in evidence-based practice is research. Has research been done on the topic to show us that it actually is safe and effective to achieve what it's trying to do? The second thing is clinical expertise. Many people have been in this field for a long time providing care, that they've tried different things, and even though there's no randomized controlled trials on a topic or research studies on it, they've seen it work over and over again, and they know that it actually does work. So there's some evidence there. And the third thing is patient values. Is it something that the patient values to do or wants to do? Is it going to be something that they're going to try or that they believe in? And is it their preference? And those things have to work together in order for us to get the best outcomes. So by now you might be asking, why does evidence-based practice really matter for me? Well, remember we talked about the stool earlier, and one of the legs is patient preferences. This is your pregnancy. It should matter to you. And what you want, desire, and believe in should matter to your healthcare providers. So if you should have questions about whether something that's happening, an intervention in your pregnancy, or something that you desire is actually supported by evidence or is the best care available, then you should inform yourself. So I recommend that you become educated and informed on what some of these best practices are. You ask me how? Well, there are 3 sites that I particularly like and go to very often, and one of those is the Cochrane Library. The Cochrane Library is full of randomized controlled trials and systematic reviews and the best evidence that's available on all different types of topics, including maternity care and interventions in labor and in pregnancy. On a lighter note, you can go to the Childbirth Connection, which is geared toward all different types of interventions in pregnancy and how to choose a healthcare provider that also values your preferences. And then the third side is evidence-based birth. We're going to provide you the links of these resources, these valuable resources. And in the upcoming months or coming episodes of Mondays with the Midwife, we're going to talk about some of the different interventions in pregnancy and what type of research is available to support those. Next week, we're going to cover natural induction of labor. I hope you'll join us. As I close out, let me just say, this week is Thanksgiving, and we're thankful for you guys. And we hope that you have a blessed time with your friends and family over the holiday. Have a great night.